So today I'm going to tell you a little bit about Tag.bio. We've developed a platform to help healthcare and life sciences companies extract value from their data faster, dramatically accelerating any data-driven initiative. COVID, of course, has become a defining factor in healthcare, and we're using our platform in a number of ways to help the healthcare industry get through this unforeseen crisis. Next slide, please. So given that we've built a platform, we thought it would be easiest to demonstrate a couple of use cases. So while we're also working in the life sciences space, we thought it'd be appropriate to highlight a couple of use cases from the UC healthcare system specifically. We met UCSD's Clinical Research Innovation Officer, Dr. Mike Hogarth, at the Precision Medicine World Conference back in January, in the before times. And we started discussing the possibility of kicking off a research-focused project at UCSD. Obviously, COVID happened and everything shifted overnight. They needed a way to analyze their COVID patient registry, and we had a platform that could help them. We moved very quickly to enable this. We had a contract in 7 days, and within 5 days of data access, we had a data portal up with analysis apps running for their researchers. An example would be of the types of questions they wanted to be able to ask. Want to know what your COVID demographic looks like? Well, there's an app for that. Want to know what is statistically significant about the cohort of patients that ended up admitted to the ICU? There's an app for that as well. This collaboration was so transformative for them that they're now in the process of moving all 70 of their patient registries into the Tag.bio platform. Now, at UCSF, it's a slightly different use case. We've been deployed there for the past couple of years, led by the Director of Value Improvement, Dr. Jahan Fahimi, and the Chief Innovation Officer, Dr. Ralph Gonzalez. The Tag.bio platform at UCSF is sitting on a combination of EMR data, billing data, and Vizient performance data. It's being used to help the organization reduce costs and improve outcomes. With the advent of COVID and the consequent dramatic reduction in medical system revenues, controlling costs has become even more critical. The UCSF medical system immediately refocused their analyses on how to control costs and to prioritize resources to help get revenue back up safely. Being able to extract value from data instantly means that data-driven decisions that previously took months can happen in a day. In the COVID era, increasing the speed of decision-making has become critical. Next slide, please. So how does this all work? Well, Tag.bio is a platform designed from the ground up to accelerate data discovery. We've done this by adopting the design pattern of the World Wide Web. Datasets and databases become data servers that speak a common smart API language analogous to HTTP. This enables data nodes to communicate with data portals, similar to a browser, as well as to communicate with other data nodes. The communication between data nodes forms a data mesh architecture, stitching together all of the data in an organization and making it actionable and interoperable. The infrastructure is important, but what it enables is critical: a new and simpler user experience around data. In the Tag.bio world, this new user experience begins with our enterprise data portal, which is analogous to a web browser in the World Wide Web design pattern. The enterprise data portal is where users can log in, access data nodes, and analysis apps that they have permissions to use. Analysis apps can be run directly by end users. Every analysis that is run creates what we call useful data artifacts, or UDATs. Each analysis, or UDAT, is saved to a user's history for reproducibility and shareability. The compendium of UDATs created by an organization get turned into a separate data node within the system to allow an auditable record of data access and analysis history, and to surface interesting UDATs, for example, a particularly costly patient cohort, or in the life sciences space, perhaps a gene signature for a cohort of respondents in disparate clinical trials. This approach fundamentally changes an organization's approach to data analysis. Instead of waiting weeks to months for analyses to be performed for a domain expert by a data scientist or analyst, now the domain experts can access data via analysis apps directly, allowing rapid analysis and, perhaps most importantly, rapid follow-up analysis. We've learned with our customers that it's rarely the first question that leads to a breakthrough. It's often the 10th or the 20th. Innovation is really a function of asking the right questions, and it's an iterative process. We allow organizations to ask a lot more questions a lot more quickly. Next slide, please. So this is Tag.bio. Our job is to enable organizations to move more quickly on data-driven decisions. And in the time of COVID, this has become even more critical. Please feel free to reach out to us directly or check out our offers in the Azure Marketplace. We'd love to hear from you and talk to you about how we could help facilitate this transformation that comes from having rapid access to data and analyses.